I'm pleased to introduce John Becker. He's a physician with UofL Physicians, and he's with the family medicine practice. He's board certified in family medicine and in sports medicine, and he's here to talk to us today about playing it safe in sports. So enjoy.
Thanks. So I figured we'd talk a little bit today just about things that probably would affect your kids more than you. Things like hydration in sports and concussions, and we'll just touch on those things a little bit, and if you all have any questions, we can certainly try to answer them. At first, I did want to just talk about what a sports medicine physician is, because in the big picture of medical specialties, we're rather new in the game. We've only had fellowship training since about the early 90s. When I did fellowship in 2001, there were only about 70 spots in the whole country, so not real common. It's growing. There's about 150 now. In Kentucky, the only programs we have are here at UofL and one at UK. I'm sorry, I think they have one in Northern Kentucky as well. But relatively new in the game. You have to do some type of primary care residency. So family medicine is the most common. You can do internal medicine or pediatrics. Emergency seems to do a little bit, and PM&R started becoming a popular choice for them as well. And then it's usually either 1 or 2 years. You have to take another test for certification, and then you can go from there. And a lot of people do it for different reasons. Sometimes it's just you want to have sort of an active population in your primary care practice. Other people are like me, where you work with a college team and you teach in a fellowship program. So there's a lot of different options you can do. So one of the obvious things, we treat musculoskeletal problems, sprains and strains. I can't fix a fracture in the emergency room, but we do casts and splints. We do a lot of overuse injuries like tendonitis and a lot of joint injuries. A lot of times we'll diagnose the problem and we'll order scans and we'll send them to surgeons if they need it. So we treat a lot of MSK injuries. Concussions like head injuries and nerve injuries, that's something that falls to us as well. And we provide a lot of care for athletes with acute or chronic diseases. So one of the things, especially with our college athletes, we have a lot of cases of mono in our college athletes at Louisville and Bellarmine. We probably see 20 or 25 of those a year, so it's a very tricky issue for a competitive athlete. And then things like asthma and diabetes and skin problems. So being a little more sensitive to the needs of their sport, it gives us that advantage to take care of our higher level athletes, and also people out in the community training for marathons and Ironman races and that type of thing. So that's a lot of what we do. And we try to help teach about nutrition. We don't do it nearly as well as our sports trained nutritionists or other nutritionists, but we try, and supplements and different training patterns, and especially recovering from injuries. So we do a lot of that. A lot of psych and anxiety, especially in our higher level athletes, they go hand in hand. So that's something that falls on us as well. Either disordered eating or eating disorders, we work with that. And then certainly issues with substance abuse as well. We do a lot about not only determining eligibility to play in sports, especially things that our orthopedic colleagues aren't necessarily trained in doing, things like cardiovascular issues and other medical problems, but also a lot of return to play decisions. And we do a lot of coordinating care, especially working with colleges, working with athletic trainers and coaches and administrators and the parents. And unfortunately, once in a while, you run into the always dangerous hybrid coach/parent, which is a very dangerous animal. So. And we talk about some of the benefits in exercise in children. Sometimes we get so beaten down about things like overuse and overdoing it and getting dehydrated and doing too much and all the different injuries that come with that. We forget that how important it is that we get our kids out there exercising. The NFL has had a great Play 60 campaign. For say what you will about what they do, they've really been good about pushing that during their games. And there is a lot of benefit. Those taking away some of the kind of negative stereotypes of the jock, it is found that for the most part, those that participate in sports actually get better grades. They get pregnant less, they smoke less, they feel better about themselves. For the most part, they really are doing better than those who don't participate in sports or exercise regularly. Certainly problems like obesity-related problems like diabetes and high blood pressure that we're seeing in a lot of our teens and preteens, certainly exercise combats that as well as anything. And then bone issues as well, getting people working out and exercising, that certainly helps their bone health on top of it. So again, we worry about the bad stuff and we worry about too much, but on the same token, doing some exercise is a really good thing. And for those here that work with any type of kids, or we know that the issues with obesity and obesity-related problems is on the rise. And unfortunately, from my side, what it looks like is that we kind of have a two-tiered deal where you got kids that do nothing or kids that do a whole lot. There's not as many doing as much in the middle. So we do have some guidelines that we do like to go by, and that's 60 minutes of exercise each day. That's a minimum. Doesn't have to be all at once. They don't have to get dressed up for it. They can just run around the house if it's raining. They can go up and down the stairs. And if you make little games of it, it seems to help a whole lot. And kids like that. They like races and counting. The idea of going for a run might be offensive to them. But if you say, okay, how quickly can you get to that tree? How quickly can you get there? They'll like those things. And that makes sense to everybody here, I would think. Moderate to vigorous activity is good, and again, little bits are fine. And we also tell the same thing to our adult patients, and should be telling it to myself just like we should be telling our families, is that little bits are fine. You don't have to necessarily go to the gym and be on the treadmill. You can take the steps, you can park farther away. Any little bit counts. And that's one of the things that we've really learned recently is that of all the things we can do for our folks, just getting them moving on some level helps them as much as anything. I believe in some studies they found it's on par with even quitting smoking. It's that good. So you almost want somebody who's heavy and moving over someone that's thin and sedentary, if that makes sense. So just getting them moving is a big, big deal. And again, little bouts are okay. If they get little bits of 20 minutes here and there, that's perfectly great. But we like to see kids moving for an hour. And there are also some myths about conditioning, and especially working out with weights. And sometimes you'll have teens and preteens more than kids aren't so interested in this, but sometimes they say, well, kids can't build any strength, or weightlifting will stunt their growth. I don't know if anyone has heard any of these things. Weightlifting isn't real exercise because they're not running and getting their heart rate up enough. You're going to injure their growth plates, and that's why they don't grow. Or this is the one, I read this in an article, I don't want my baby hanging around with half-naked, iron-pumping hooligans. So, now granted, working with the athletes at university level, yeah, there's a fair number of hooligans there. There's also some really good guys too. So those are the myths. So what about the facts? Well, kids can build some strength. Doesn't necessarily going to develop the visible changes of it, but they will be stronger. They have not ever found that it stunts a child's growth. And weightlifting in its own, if anyone here goes to the gym and lifts weight, you know your heart rate goes up. So that's certainly a very effective way for them to be active. And I think it's like anything else. If you're doing it with your kids, you shouldn't. If it's you pushing them to do it, it's one thing. If they want to do it, it's a really good thing. Growth plate injuries are terribly uncommon, just a very rare case reports. And then they found that in adolescent girls, they found in studies that it actually improves self-esteem. So there's a lot of good things to be gained from that being an effective way to get them some exercise as well. The one thing you want to do for kids doing anything with strength training or with any sport in general, make sure they're doing it because they want to. One of the things that comes up at meetings I go to where they get physicians that do care for marathons, you know, they talk about, some have age restrictions saying you have to be 18 to run a marathon. And one of the gentlemen, and I know him, he runs a big race up in Minneapolis. He said one year, they never had that. And one year he got an application from a 14-year-old. So he called them and said, well, wait, what's going on here? And what he wanted to make sure was that the parent wasn't pushing him. So what happened was the kid was going for runs with his dad, and they would just go around the block. And then he would start doing them on his own. And Dad got home one day and said, oh, did you run today? He goes, yeah, I ran around the block. He goes, how many times? And he told him, he went around 78 times, whatever this little neighborhood was. He goes, what? So he went running with him, and the kid knocked out 17 miles. He goes, well, let's go run the marathon. And he was going to run with him, and it seemed appropriate. But the key here was the kid did it on his own, and it wasn't a parent saying, you need to do this. It was a kid saying, I like doing this, and I want to do it. And I think that's a big difference. It's one thing if people are doing a sport because they want to. It's another thing they're doing because they have to. So I think that's where you can run into a little bit of difficulty. And again, if you have reasonable supervision and someone that teaches good technique, there's no reason that kids can't do really whatever they want. Now, there's a lot of gray areas in sports, and especially the kids. There's one that isn't a gray area, and that's with the energy drinks. For the most part, these have been banned by many high schools of being even available on the field or near the field in a lot of different states. Just keeping in mind, this is a many billion-dollar-a-year industry. One of the things that they've gotten very creative with is that the labels on these bottles, or just about any other supplement you can buy in the GNC store or anything like that, they are not held to the labeling requirements that we have in food or that we have in our medications. So they can put anything they want on the bottle because they say they're a nutritional supplement. And this was the outcome of a law that was passed in the 90s. So there can be any amount of caffeine in there. They could lace it with anything else they want, especially all the muscle building things they can buy. They can put some type of hormone in there that you don't know about. So you can't trust any of these things, unfortunately. The amount of caffeine in these is kind of ridiculous. It's a lot. So the kids should not be, just a general rule, kids should not be getting these energy drinks whatsoever. A lot of reports out there of some very nasty side effects. And it can interact with medications, antidepressants, ADHD meds, and lots of kids are on stimulant medications, so you gotta be really careful with that. It can make them more prone to heat illness because basically getting that big caffeine load gets their heart rate up. It kind of sets their body temperature up a little bit. Their heart rate can go up, their heart can stop, their blood pressure can go up, trouble sleeping, anxiety. So again, nasty stuff. So avoid the energy drinks. Again, this is from the Journal of Pediatrics, 2011, basically saying there is no place in the diet of children and adolescents. Now, kids may like it, obviously. And it's one thing if they like it and want to do it, but again, it should be certainly discouraged. And the amount of caffeine they get in these energy drinks would actually cause them to fail most drug tests that are done at those elite levels of sport. So just something to think about, just really a bad mix. Now, that being said, hydration is a good thing. We do like our kids to get about a half a liter of half a liter of fluid before activity. For those that do longer bouts, if you got kids that are really active, playing in soccer tournaments or running cross country or doing a lot of miles, it is not a bad idea to maybe on a hot day weigh them before and after, and they'll give you a really good idea how much they sweat off, and then you can translate that and just say, okay, let's replace the fluid. It doesn't have to necessarily be difficult. If you want to know if they're hydrated before they go do activity, especially in a hot week like this, a really easy way to do it is say, could you go pee right now if you had to? And if they say no, then maybe they haven't drank enough. And if they do, it should be kind of clear or yellow. And we always tell our athletes we like clear, we like lemonade, we don't like iced tea. So that's the best way to put it. As far as the sport drinks, for a lot of kids, there's really no role for those calories. But for kids that are really in longer bouts of exercise, especially tournaments and things like that, that's okay. They probably need the carbohydrates, and there's a little extra salt and sugar that make it palatable. If they took that all out of them, the stuff would taste pretty vile. And as far as the environment, we really try to avoid extremes. I've gotten in some general discussions with our athletic trainer in football. I've had days where it would be like this week, I'm like, they cancel wars in this weather. He's like, yeah, we don't cancel football practice. So, but in high schools, they should have some very specific rules about days where you can and can't practice. For sports like soccer, they should adjust substitution rules, take extra breaks. So for kids among that age, once you get above, once you get to the college level, it gets a little dicier, but they should do that. One thing that's really good to do is to make sure your kids are acclimatized to the heat. One of the problems we run into is when kids are starting, especially football, and they start camp at the high schools in July or for our college guys in August, they're not ready for it, and they go put on those pads, and it's really hot, and they've been inside for the last couple weeks. That's difficult. So try to get them outside for a couple weeks before they get there. It really, really makes a difference. And then again, you want to watch for signs of dehydration and illness. Yes, you exercise a lot, you lose weight, but you shouldn't lose a lot of weight in 2 or 3 days. So that's something you want to keep an eye on if you got kids involved in any kind of aggressive sports. Early warning signs of heat illness: fatigue, diminished performance, nausea, dizzy, lightheaded. Those are all things. Cool place, hydrate, rest, and that's going to be your treatment. More worrisome, and these are the things you want to go to the hospital: really bad headaches. Not just, I got a headache, like really bad headaches. Passing out, confusion, anything like that. If they're mentating any different than you would expect, they need to go get seen. So we'll talk a little bit about concussions. When I was talking with Elizabeth about what to talk about today, she's like, I don't think people are that interested in concussions. And I said, Elizabeth, I don't know if you get ESPN then. So anyway, obviously, if you watch sports on TV, concussions is a huge topic. And I think the big thing is when it comes down to how we take care of our kids, it's just more of an awareness than anything else. I think that's the biggest thing. The numbers that they talk about as recently 2010 are anywhere from 1.5 to 3.8 million per year. That number gets quoted everywhere. It was amazing that up until 2010, the number that was quoted was about tenfold below that. So I'm pretty sure there was just as many concussions. It was just people I don't think were paying mind to it. And those numbers, really, people have no idea. We know there's a lot of undiagnosed concussions out there. The minority go to the emergency room that night to get seen, but some do. And this is the number 2 cause of traumatic brain injury in kids, obviously car accidents and accidents being number 1. And this is a pretty good number. About 5 to 10% of all high school injuries, and 1 in 5 high school players do get a concussion at some point. So it's a very, very challenging topic. When we look at the number per exposures, and that's the way they measure these things, it makes sense that things like football and ice hockey are the top. Wrestling gets some. That's not a big estate here. This, at least in Kentucky, it's not as much hockey as wrestling, but lacrosse is on the rise around here, and soccer is obviously a very popular sport. And that's really where we see a lot of the growth. We get, I would say, even at U of L, women's soccer has probably been my most challenging concussion team, even compared to football. They really get a lot of them. So it's something you got to be really careful with, and especially watching for it in your kids. Well, what are the challenges? Well, first off, we're not really good at preventing them. Obviously, helmets have a role in football. You can't play without one. Helmets in soccer don't seem to help. There's some thought that maybe mouth guards help, but they don't prevent them all for sure. Certainly, playing appropriate rules, not using your head to tackle people with, not using your head as a weapon, that's okay. We don't think hitting the ball is a problem, but hitting someone's knee or hitting the ground or hitting someone else's head is a problem. But what we find out is that sometimes these can be, people get prolonged symptoms, and they can be permanent. Fortunately, if we sort of intervene, we can hopefully avoid that. What are the problems we run into? Well, problems with memory, problem solving, early dementia pictures, seizures, motor problems. One of the things I found scary was that 3 concussions leads to a 3 to 5-fold increase in depression and learning disorders. I found that to be kind of scary. And the thing that is really challenging for me is, how do I know if I see that athlete, that kid, that young adult, and say, okay, you're the one that's going to have problems with this, and you're not. You're fine, you can go back. I can't draw a titer, I can't do a test, I can't get a scan, and it just comes from just hopefully some good experience, but we don't have a way of sorting that out right now. There are some that we think might be at risk. Once you have one concussion, you are really likely to have a second one. The chance of having a second one is, I think it's 5 to 8 times what it is for somebody, 5 to 8 times to get another one than somebody never had one. Does that make sense? So your chances really go up. If they are increasing in severity, the first one, well, I was fine that day. Now I got another one when I was a senior, and I was gone for a week.